Hello, and welcome to the presentation for Group 1. Tonight, we will be presenting on attachment disorders. We will be going over attachment and why it is developmentally important. We will review the different types of attachments, and then jump into attachment disorder, their causes, their symptoms, effects, and prevalence. We will then look at attachment disorders from a multicultural perspective, why this topic is important to counseling, and how counseling can help. We will conclude with current treatments for attachment disorder, our conclusions, and further recommendations for research. All right, let's get started with why attachment is important. Attachment theory maintains that real elements of the bond between the caregiver and child have lasting implications for development. It provides the framework for how we are going to develop relationships, develop empathy, and relate to others. Attachment theory supports the supposition that there is no such thing as an individual brain. In fact, researchers have discovered that the way we attach shapes our neural networks that are the vehicles of the attachment process itself. Neural networks then reinforce the same interpersonal dynamics, which leads us to attach to others the same way we did to our parents, which is why the relationship between the child and primary caregiver is so important. True attachment does not begin to form between the child and primary caregiver until 6 to 8 months. It is the first social relationship, and children and infants who do not have a good first relationship experience are more prone to have other developmental problems. There are two different types of attachment styles, secure attachment and insecure attachment, and there are 3 subtypes within insecure attachment. The first is secure attachments. Those with secure attachments often have attuned, perceptive, and responsive primary caregivers. These individuals will likely be empathetic and will be integrated socially, emotionally, and cognitively. There are 3 forms of insecure attachment, which are characterized by less positive experiences between the infant and the primary caregiver. Avoidant attachment, which is characterized by a child not relying on their primary caregiver for support, and they often tend to be logically oriented and emotionally distant. The second is ambivalent anxious attachment, which is characterized by a predisposition towards anxiety, worry, and overwhelmed emotional and cognitive states. The third type is disorganized attachment, which is characterized by an inability to organize the mind in the presence of stress. They often have erratic and inappropriate social behavior. While there is some debate in the literature regarding the relationship between insecure attachment and the development of attachment disorders, the most extreme expression of negative first relationship experiences is the development of attachment disorders. There are 2 identified types of attachment disorders. The first is reactive attachment disorder, or RAD, which is characterized as the inhibited version of attachment disorder. It is characterized by social withdrawal, hypervigilance, and relative ambivalence towards caregivers. The second type is disinhibited social engagement disorder, or DSED. This subtype is considered the disinhibited version of attachment disorders and is associated with indiscriminate friendliness, inappropriate social behavior, especially towards strangers, and overly familiar verbal and physical behavior. In order to properly diagnose attachment disorder, the child must be at least 8 to 9 months of age developmentally, which is when true attachment is supposed to begin its formation. There are a variety of causes of attachment disorders. However, they all center around a negative first relationship experience between a child and their primary caregiver. One cause of attachment disorder is severe neglect by the primary caregiver, wherein the primary caregiver provides extremely inconsistent care for the child. Another cause is the child experiences maltreatment from the primary caregiver, which can be characterized by physical and sexual abuse that the child experiences at the hand of their primary caregiver. Another cause of attachment disorder is persistent changes in primary caregivers. This can be characterized by early separation from the primary caregiver. Children who enter foster care at an early age are exposed to multiple caregivers throughout their childhood, and children who are institutionalized are also susceptible to attachment disorder. Researchers agree that the core cause of attachment disorders is poor primary caregiving, which again highlights why the nature of the relationship between the primary caregiver and the child is of critical importance to the child's development. Children with attachment disorders tend to demonstrate cognitive impairment and language problems. Children with attachment disorder also experience maladaptive emotional development, which includes poor responses to stress, poor emotional regulation, and poor coping strategies. They demonstrate poor and inappropriate prosocial behavior and have difficulty with developing interpersonal skills and forming secure attachments with others. They also can display poor empathy and moral reasoning, again, likely due to the underdevelopment of the brain's emotional regulation systems. Insecure attachment is significantly more prevalent than attachment disorder. Attachment disorder is most prevalent in cases of extreme neglect, foster care, and children who have been institutionalized. Of the population suffering from attachment disorder, the predominant population is 30% psychiatric inpatients and 40% in foster care. I am now going to turn it over to Roy to talk about attachment disorder from a multicultural perspective. Over to you, Roy.
Thank you, Kim. I'm the brown-skinned guy, so I think it's kind of fits the bill with me talking about the attachment theory from a multicultural perspective. There has been very little research on attachment patterns among African Americans in the U.S., which, they are the largest minority community in the United States. Among Asian communities, a large number of people have an insecure attachment style described as an avoidant attachment characterized by emotional dismissiveness, avoidance, or withdrawal. However, looking through the Eastern cultural lens may reveal that many of these insecure attachment diagnoses may be merely a biased cultural understanding of what a secure and insecure attachment styles look like. What do I mean by that? Attachment goals from a Western perspective move the individual from a reliance on a safe base to a personal exploration, encompassing a wider and wider periphery with a goal of autonomy. In the West, independence is a value. However, in the collectivistic cultures, for example, the goal of the caretaker would be more apt to encourage mutual effort rather than reliance on self. So what does this mean? It means that in the West, the value is independence, but in the East, the value is dependence. So how do we say that someone has secure attachment style? It is from the point of view of that if a person achieves autonomy as they become an adult, we say, oh, they are securely attached. But that may not be culturally appropriate coming from a Eastern cultural point of view. And in order to substantiate those those comments, there were studies done in China. Those studies show that the important role that extended family plays in the unfolding of attachment behaviors of a child. Additionally, this study found that attachment behaviors are displayed in ways most suitable to culturally accepted norms. For example, Chinese parents placed a lot of importance on interdependence rather than independence, and that grandmothers played a very important role in caring for the child. There was an emphasis on emotional control and harmony while negotiating interpersonal relationships. A similar finding in Western cultures might have categorized the attachment behaviors as insecure. And there was a similar study that was done in Israel, where ambivalent styles were represented and avoidant insecure attachment was underrepresented. In the Israeli case, attachment was studied through the sleep arrangements of children in the kibbutz. Researchers found that children who slept with their parents were securely attached. And that was my personal experience too, is that, until the age of 11, I shared the bed with my parents, while those who were Going back to the research, while those who were with an unfamiliar person at bedtime demonstrated insecure attachment, sleeping with parents in Western countries may not necessarily be encouraged, further reiterating the notion that attachment may best be understood within its cultural context. So, from the West, if we say that if someone from the West would look at me and say, oh, you slept with your parents or shared the bed with your parents until the age of 11, oh, you were not securely attached then. But that's only a Western perspective, not an Eastern perspective. And then there was a study done in Puerto Rico with the Puerto Rican and the Anglo group findings. The highlight of the study was that predicted association between insecure attachment and increased levels of maternal control was not found, indicating that maternal control does not necessarily have a negative effect on attachment. The study found that Puerto Rican mothers use a high level of physical control. While attachment theory regards this aspect as insensitive, the study findings suggest otherwise. The highest levels of physical control were associated with secure attachment for the Puerto Rican pairs. Based on that finding, the researchers proposed the need to be cognizant of culture-specific conceptualizations of the caregiving system. So in conclusion, attachment theory is able to provide the framework to give the therapist a significant diagnostic and treatment instrument. Without the inclusion of multicultural considerations, the use of attachment history is not only impotent, but potentially damaging. The employment of multicultural attachment information has the potential to be a lens through which the clinician can enlarge the image. Over to you, Tori.
Okay, so Kim and Roy touched on it a little bit, but attachment disorders and their importance to counseling. Basically, research has linked certain kinds of psychological dysfunctions to insecure and disordered attachment. So anxious attachment is associated with dependent histrionic, borderline disorders, anxiety, and depression. Avoidant attachment is associated with schizoid, avoidant disorders, anxiety, and depression. RAD is associated with hyperactivity, aggression, attention deficit disorders, and a lack of empathy. And DSED is associated with attention deficit and a lack of empathy. So basically, this stuff is so important to counseling because if we as counselors have this prior knowledge and education in attachment disorders and even our clients' individual attachment types, we can help them to a higher degree of healing and just understand them on a deeper level and as a whole person. It's our duty as a therapist to acknowledge the attachment style and or disorder of our clients. With anything other than a secure and healthy attachment, our clients will rely on the therapist's skills to provide safety and just a secure emotional presence. So secure attachment is a precursor for any desired behavior change. RAD is definitely more responsive to enhanced caregiving than DSD. And adolescents are uniquely positioned to shift their perspectives between the children they once were and the adults they will soon become, thereby enabling them to process childhood experiences and incorporate their insights facilitated by the therapist toward construction of a resilient adult persona. Children with insecure, preoccupied attachment styles and or disorders have the chance to identify ongoing fearful, insecure, and anxious patterns of their behavior and be able to interrupt these processes. And this enables them to increase their ability to interact more positively and securely. Long-term treatment will be more helpful to children with insecure attachment styles and disorders because they appear unproductive and resistant to group therapies. We will go over to Felicia for treatment.
Thank you, Tori, for that. Now we're going to talk about treatment, intervention, and counseling strategies. As I was doing my research, I noticed that it was geared towards more children than adults. So we're going to talk about treatments in children and how they can help with the detachment disorder. There should be a careful plan to generate around children with attachment disorder. Intervention should include, when developing your plan, self control, self identity, understanding consequences, reinforcing reciprocity, and nurturing. It is very important when when you're doing this intervention that you remind the child to have self control. Also, for further recommendations on intervention, should also address self esteem and the self efficiencies to improve their overall functioning. Because school can be a trigger for children with a detachment disorder, it is imperative that they learn to regulate their feelings and actions. There are a few things that a counselor should consider when they're at school. The first thing a counselor should do as a strategy is be deliberate. Make sure that when you're doing this, that you are deliberately doing this for the child. Provide consistent instructions. Do not be inconsistent. Be reliable. Be predictable. Create a secure learning environment. Let the child know that you're there. Let the child know that they're in a safe environment for them to be able to express themselves. The most important thing about the treatment for the client is to have a safe and nurturing environment. The next stage is to improve the relationship between the child and the caregiver. Parenting classes combined with family counseling can be helpful, and also medications such as SSRI or Florentine, Prozac, or Zoloft, the anxiety for depression. According to the National Institute of Mental Health Trust Sources, fluoxetine is the FDA-approved SSRI for children ages 8 and older. It is important to monitor children taking these types of medication for suicidal thoughts and behavior. This is a potential side effect, but it's not necessarily common. Without appropriate or prompt treatment, a child with RAD may develop other related conditions such as depression, anxiety, or even PTSD. Back to you, Tori.
All right. So in this presentation, we talked about what attachment disorder is, why attachment is important, its importance in counseling and multicultural implications, and treatment intervention options. Attachment is essential for our growth and development because it affects our future relationships and the way we interact with the world around us. And our main takeaway and recommendations are that attachment disorders and attachment theory, basically, we just need a lot more research. More research for the multicultural lens and especially the disorder in adults, because a lot of the studies were done on children and the implications for them and their growth over time. But even those research articles said that not enough research is done. So those are our recommendations, and that was our presentation. Thanks for joining us.